Okay, thank you everyone for participating today. Before we get started with the actual stakeholder meeting, we want to make sure that you can hear us okay, and that our audio is working. So the way we can tell that is if you can raise your hand, that lets us know that you can hear us. Great, thank you. Alrighty, so welcome. It is May 19th, 2020, and the time is 10:31 a.m. Thank you for attending the State Board of Pharmacy stakeholder meeting via webinar today. Before we start, we want to introduce ourselves, the staff members from the Division of Professions and Occupations that are also joining via webinar. My name is Darcy Magnuson, and I'm a regulatory analyst with the division. Also attending is Dimitri Kunin, who is the program director for the board. Yukon Morford is a program manager for the board, and Elena Kemp is a regulatory coordinator for the division. We'll be facilitating the stakeholder meeting today. In compliance with the governor's order regarding COVID-19, the division has transitioned to a platform that is 100% virtual, and we appreciate your flexibility. As many of you have been to DORA stakeholder meetings before, we would like to reiterate the importance of your comments today. DORA makes decisions every day that may affect your life and your business. Your input is vital in the rulemaking process. Throughout this process, our goal is to create regulations that clarify and explain legislation, ensure minimum competency to enter and continue to practice, and provide only what is absolutely necessary for consumer protection without creating unnecessary barriers to the marketplace. Your input will be part of the information that goes to the board as it considers whether to adopt or amend the new rule changes we will be discussing today. More specifically, Rule 30, temporary suspension of State Board of Pharmacy rules related to COVID-19. This meeting is being recorded and will be posted on the website at a later date. As this stakeholder meeting is held solely by webinar, please raise your hand by using the hand icon if you'd like to speak, and we will unmute your line so that you will be heard by everyone. Or you can type your comment in the question section and we will read it aloud. Before we start taking comments, we ask that anyone providing comments please state your name and who you represent. Feel free to provide either general comments on the rule changes or specific comments on the proposed language. Keep your comments limited to 3 to 5 minutes or less, and try not to repeat something that was already said. However, you can state if you're in agreement with something that someone else said, and we will note that. If you're using audio through your computer, please remember to put any phones on vibrate or turn them off. And whether you are using computer or phone audio, try to keep background noises to a minimum when speaking. So at this point in time, we do have the red line version of the rules showing on the screen, and we will start taking stakeholder feedback. So like I said, if you want to speak, you can raise your hand and we can unmute your line, or you can type in a question and we can read it out loud to the group.
Looks like we have a hand raised by Emily for a comment.
Let me get there. I'm sorry, it's not popping up clearly. Do you want to unmute, Dimitri?
Yeah, let me see if I can do it. So Emily and Gina, I see your hands raised, and I'm just going to go in order how I saw it. So Emily, I'm going to unmute you. So Emily, you should be unmuted. Go ahead.
Hi, good morning. Can you hear me?
Yep, loud and clear. Good morning.
Great. Good morning, everyone. Emily Zadvorny, representing the Colorado Pharmacists Society. I had a few comments on several of the line items. Do you want me to go through that, or were you planning to go line by line? I just wanted to make sure I, followed whatever procedure you want.
Yeah, and things can come up later too. Ideally, we go in order just to give everybody a chance. So if there's a comment you make on, rule 1, and if somebody had to or wanted to discuss that, we can kind of take that one at a time. So let's just take it one at a time, and then we'll move on if there's no other comments. Is that fair?
Perfect.
So go ahead.
So I didn't have any comments on rule 1. My first comment was on rule number 3. So neither 1 or 2, just rule number 3 to start out with, if that's okay. And I think my overall comment with rule 3, which had suspended rule 6.00.30, is that there's a very large thought that we need to continue to be able to test for COVID-19 in all settings in Colorado, in all pharmacy settings. So one, I wanted to clarify that this does, if we can, ensure all settings can test, but also to be able to continue to test for COVID-19 as currently authorized.
Okay, and specifically, Emily, just rule 3 that addresses rule 6.00.30. Understandably, rules when this was put forth, rule 6 and rule 17 weren't official in their most updated form. As of the 15th, they are. So technically, rule 3 is obsolete or repealed based on what happened with that update. However, that's taken into account, I believe, in number 5, rule 17.00.30, which sets forth pharmacists' qualifications for collaborative pharmacy practice, including the requirements for education. And then in terms of the setting piece, the COVID testing part that was put in that we're going to get to in just a little bit, that I don't think it's specific on the specific site. Are you referring to whether it's within a licensed space or not?
Correct. I think the concern is that, currently under the emergency period, we have the federal government authorization and the state under the emergency declaration. But the concern would be when that 120 days or a further period down the road expires, there's still going to be a need for testing and allowing pharmacists in the state of Colorado with appropriate scope and authorization to be able to continue that testing to help support the public health initiatives for the state.
So just make sure I understood that right. The concern is that this is time limited, and then what happens after the 120-day expiration, correct?
That's correct. And just making sure that we really do have that broad authorization in all settings, since this was,
Gotcha.
Yeah, thank you.
Yeah, so just to be clear too, the pharmacy board, much like other boards, has not gone through the emergency rulemaking process often, if at all. So this is kind of new territory in general. So I want to reiterate and set the stage, and I think everybody understandably gets that COVID is not going to go away within 120 days, right? To your point. So what's in front of the board now in terms of stakeholder feedback, the intent of this meeting is to, just like any other stakeholder meeting, get feedback, whether you support or you have questions about or concerns, or you reject the idea of a certain rule or aspect of rule, because what the board will be considering in its future hearing is whether to take and turn some of these rules into permanence and adopt them as is, where they become rule and that's it, or to reject them or let them expire at 120 days and then they drop off. And understandably, some of these apply uniquely to COVID, and they may last in permanence for 6 more months or 2 more years. And at some point, the board may, just like in any other rule, consider drafted proposals to repeal or to make further edits to permanent rules to adjust to the times as necessary. So your points are very well taken. I'm going to go to the next individual with a comment, but I just wanted to kind of set that stage as well, or provide a reminder, since this is new territory for everyone. So let's see, Gina, I'm going to unmute you. Go ahead.
Okay, great. Thank you so much. So thank you. I think you addressed much with your comments back to Emily, much of what I might have been asking or commenting on, but my specific comment, and I should introduce myself, sorry. Gina Moore, I am Assistant Dean for Clinical and Professional Affairs at the University of Colorado Skaggs School of Pharmacy, and my comments represent the School of Pharmacy. So specifically talking about number 2, which is suspending Rule 5.01.40A, which addressing the requirement of minimum number of hours of operation for a prescription drug outlet, and want to support that from a school perspective. We officially have a prescription drug outlet that is essentially set up to provide a means to order drugs for student training. It's not to provide any services to the public at all. And that particular prescription drug outlet is housed in a building that is very limited access and will continue to be very limited access through the COVID period on our campus. So thank you for suspending that rule. I would also ask that the board consider more permanent implementation of a rule like that. I'm not sure that it does anything for public protection in this day and age. So I'm not even, I would question whether or not that is necessary, but really appreciate that suspension because we don't have a means to keep, the PDO outlet that we have open minimal hours because of the COVID pandemic. Thank you.
Yeah, absolutely. Appreciate it, Gina. All right, and then I see Angie Howes. You have a hand raised. Angie, I have unmuted you. Go ahead.
Hi, Dimitri. It's Angie Howes with the Colorado Retail Council, representing the retail chain pharmacies in the state. Thanks to you guys for all the quick work you did implementing these rule suspensions. They really helped our members meet the demand that they were seeing and be able to adjust their operations to the COVID-19 crisis. Specifically, and I'm sorry if I'm being redundant, I'm trying to track where we are today. There's 3 areas that our members have mentioned that they'd like to see these rules permanently suspended or repealed, whatever the right terminology is. One, as Gina started, or not Gina, but Emily with CPS started out with Rule 600.30, the qualifications for pharmacists to engage in drug therapy management, and then also the COVID testing that's part of that. We would like to be able to have that a permanent change, simply because we want to be able to quickly respond to any testing needs or any additional pharmacy needs that patients have should there be a spike again in COVID infection rates, and also as testing continues to be something that's needed. Additionally, the remote practice requirements in particular have been very helpful to us operationally. That's 26.0020. G, number 8, which outlines the remote practice pharmacy requirements, thereby allowing remote practice without application. We're interested in seeing that something that we can permanently implement. It's easy for us to have that. It would be easier for us to have that as a permanent change should we have to respond pretty quickly to different needs throughout the state. And then the other one that they pointed out was 19.0.10 on vaccines. Where is that?
I think 19.01.20, is that the one you're referring to?
Yes, that's right, 20 on vaccines. They were interested in a discussion around that becoming a permanent suspension.
Great, Angie. Thank you for the feedback. You raised a few good clarifying points, and I just want to take a moment to address them. So at this time, the board, based on their decision and your feedback, will be deciding to continue to to make these permanent rules or not. And they can go one of two ways. They could take the suspensions and keep them as a grouped part of suspensions under the new Rule 30, or they could take the individual pieces and repeal them. What the board will consider is whether the repeal part has some negatives associated with it, and they kind of lose track of the rules when and if a time comes in the future, hopefully it comes, right, where things get back to normal and they can look back and assess, here's the group of rules that we took action on and made permanent that suspended, or in other words, repealed parts of law. Do we want to continue this indefinitely, or was this only specific to the COVID crisis, which is now behind us? The way it's structured now, everything is housed within Rule 30, and whatever they decide to make permanent, if they go the route of making a suspension permanent, it would be a permanent suspension within Rule 30 rather than a repeal. And that really would only serve to keep it more organized. Should anything else need to be added in the future or subtracted, that could happen as well.
Okay, thank you.
Yep. So I'm going to mute you, Angie, and then Emily has a comment. So Emily, I am unmuting you now. That didn't work. Hold on. Oh, Emily, you're self-muted. There you go.
Got it. Thank you.
Yep.
So appreciate your comments back and clarifications. So it helps us to understand, the context you just reiterated. So I think that, we wouldn't support permanent suspension of all qualifications for collaborative practice agreements. So I just wanted to get that on the record, that we still would want that reinstated at some point, but just again to make sure we have the ability to test and then vaccinate. And so I did have a comment. We would also support what Angie said about the remote practice requirement, number 8, Rule 26.00.20. We've heard from our membership that it's been very helpful to be able to do remote practice. So we would support that. And then I also wanted to comment on number 13, which is suspension of Rule 29. Our understanding is that the testing centers for technician certifications are opening back up, but perhaps, of course, like everything, slowly. And so we wouldn't support a permanent suspension of Rule 29, but perhaps looking at the board considering an extension beyond the 120 days again, to allow, not undue stress on our pharmacies in complying with getting their techs certified. And then finally, under Part D, I think this is where you guys, if I'm understanding, these seem new rules or testing rules. Okay, so under D, Part 1, certainly support that because it does speak to the testing. So hopefully, and I guess what my question is this still says that it's during the 120-day time frame. So again, looking at that may need to be more of a permanent type of situation if we can get that. And then wondered if we could ask for, under that same section, somehow the vaccine authority to be able to order and administer the COVID vaccine that would be approved without additional authorization needed.
Emily, let me add, so I'm glad you pointed out D1. So D1 is essentially what I was referring to when we were talking about Rule 6 earlier and testing sites. This is essentially the rule that tries to clarify the ability to order and administer tests. But from a vaccine perspective, keep in mind rules are only there to further clarify what is otherwise not another rule or statute, more specifically. From a vaccine perspective, I anticipate the vaccine for COVID not being any different than any other of the vaccines that pharmacists are able to administer today, correct?
Correct. I think what we were hoping that the board could consider, if possible, is not having to have authorization. Right now it's per authorization from a physician. So that, but more importantly, I think we had a little bit of concern about it being in current rule CDC approved vaccines, which we assume the CDC will ultimately endorse any vaccine that comes out. But if, for example, the FDA approved a vaccine and there was a lag time, who knows how long between FDA approval and CDC endorsement, that we would be able to administer that vaccine. I believe right now we couldn't do that per current rule.
If it was not a CDC approved vaccine, is that correct?
Yeah, if it was FDA approved but not CDC endorsed, yeah.
Okay, noted. Thank you. Okay, I see a hand raised by Lori. I apologize if I get the last name wrong, Walmsley. I'm going to unmute you. Lori, you're live.
Yes, thank you, Dimitri. Lori Walmsley on behalf of Walgreens. Can you hear me okay?
Yep, loud and clear.
I would like to reiterate some of the comments that have already been made. First of all, thank you to the board for this process and for taking a proactive look at the rules and regulations related to COVID. First, in terms of the COVID testing under D1, we absolutely would support this. We're currently testing in 15 states today and have the desire to expand to Colorado. A couple points of clarification. Under the section above under C3, where it references Rule 6.00.30, it mentions conducting testing in pharmacies and other testing centers. I just want to make sure that we would be able to perform these tests in a non-pharmacy location, so a drive-through location, perhaps not even at a permitted facility, using permitted pharmacists. So clarification on that. Secondly, under the new section D1, want to ensure that to clarify that pharmacists also have the ability to report the results to the patient, as well as the Department of Health. There's been some question in some states about whether or not pharmacists could do that if that's considered diagnosing. So the ability to make sure that pharmacists can report those results as appropriate to the appropriate entities. Lastly, I would definitely agree with the permanent suspension of 26.00.20 related to remote pharmacy practice. This is something that we definitely think is a benefit to the state and something that is occurring in most states. I would like to suggest a slight modification under 26.0020E. I would suggest that you look at modifying the remote pharmacy practice may include, but is not limited to, duties conducted by pharmacists, pharmacy interns. The pharmacist is missing there, and that as long as the pharmacist, as long as a person holds credentials in the state which they reside, and the work while conducting remote pharmacy practice, pharmacies are located in Colorado. So kind of specifying a little bit more about to include pharmacists in your definition of remote pharmacy practice, and also the location under B where it can occur.
Okay.
But overall, we're in support of the rules.
Okay. Lori, thank you. I'm just finishing up my notes on my end from everything you said. Lori, if you don't mind, just to make sure I don't get the wording wrong, I know you mentioned the word pharmacist was missing in 26.0020E.
Yeah.
I just want to make sure that I transcribed it right. If you could, you're more than welcome to just shoot a quick email with like a
absolutely.
red line.
Happy to do it.
If you could make it a red line, just so I can see the difference. I just want to make sure it's correct.
Yeah, perfect. I'll send it over to you, Dimitri. Thank you.
Thank you. Appreciate that.
Appreciate it.
In regards to the question that's come up a few times, or the concern around making sure that pharmacists or individuals can be tested and tests can be performed outside of a quote licensed space. There's no issue with that in terms of location. I know we have board inspector or two on the call. I wanted their perspective so you could hear it as well. But there's no issue there. But let me see if they could articulate that for you a little bit better than I can, because I get the concern. Hold on one sec. Hey, Elena, if somebody is dialed in, I don't see their name on the list. Is that correct?
I think you should do, this is Darcy, I think you should still be able to see their name, even if they use the phone option for audio.
Really? Yeah, because I know that Chris is on. It's okay, we might just come back to that. I think Mark, you're on too. Mark, do you mind speaking to that for just a quick second about the ability for individuals to test for COVID in relation to how the rule is currently there out in an unlicensed space for example, drive-throughs, parking lots, etc.
Can you hear me?
Yep.
Oh, hi. So I would think the test is going to be a non-prescription test, right? I mean, it's not going to be we're not talking about the actual vaccine at this point. So
yeah, and there's dozens of tests out there, potential tests. I think a lot of them are nasal swabs.
That's where I'm going with it. Yep.
Yeah.
That's where I'm going, because the only thing we have right now is if you are doing vaccines, you would need to, we ask you to keep records of vaccine leaving the pharmacy, coming and going. But this, like you said, strep throat, there's a number of different things that are tested for, and I'm not aware of anything in the rule that would stop them from doing it, acting as a pharmacist outside the pharmacy in that situation.
Yeah, and technically speaking, Mark, I'm just going to bounce this off you, because even vaccine administration, when that is done in a lot of scenarios and settings, it's done outside of what we otherwise call the licensed space, right?
Correct. Yes, it is. Yeah, and the only thing we do there is we just ask them to keep track of the vaccine, because of course the pharmacist can't own the vaccine or keep it in their house or anything.
Right.
But he or she can take it with them if they fill out the paperwork at the pharmacy.
Yeah. Okay. I think that helps a lot. Mark, thank you. I'm going to keep going, but we may come back to you, okay?
Okay, don't forget to mute me because I'm in a parking lot.
No worries. Thanks. All right, so Lauren Paul, I'm going to be I was going to unmute you, but it says attendee can't be unmuted until they enter their PIN. Click to send PIN. So Lauren, I'm going to send you your PIN, and you'll need to enter that to get unmuted. And looks like your hand went down. So I'll let you do that, and then we'll come back to you once you're ready. And if there's any questions and follow-up from what Mark just mentioned, feel free to raise your hand. All right, Lauren, I just unmuted you. Go ahead.
Perfect. Thank you, Dimitri. Lauren Paul on behalf of CVS Health. And I also wanted to echo my appreciation and sentiments to the board for the work that they've done, doing some of these suspension and waivers and amending rules to allow pharmacists, pharmacy interns, and technicians to be able to help patients throughout this crisis. One point that I wanted to make is that Rule 6 was repealed as of May 15th. So if we do move forward with this, I believe the change would need to be made in Rule 17, which is where the drug therapy management and collaborative practice have now been put together. So I do think if this is to become more of a permanent rule, or even on this temporary rule, because that rule is repealed, I think there needs to be some clarification so that we can ensure that that testing can occur. And then just additional comment on the remote practice. similar to what some of my other colleagues have already said. Very supportive of the remote practice, specifically the suspension that requires approval by the board, as well as the addition of technicians and interns. Just to give a little bit of context, under normal day-to-day circumstances without COVID-19, 11 states already allow technicians to work remotely, performing prescription processing functions. 29 states allow pharmacists to work remotely. And of those 29 states, only 4 of those states, including Colorado, require an application or approval for a pharmacist to work remotely. We will say, in light of the pandemic, we have seen an additional 34 states, including Colorado, either through guidance, waivers, emergency regs, or suspension of laws and regs to allow technicians to practice remotely. And then on top of that, an additional 16 states have allowed pharmacists to work remotely without approval. So just based off of that, those facts and what we're seeing across the country, we would support the permanent allowance for pharmacy technicians and interns to work remotely, as well as the permanent suspension of the requirement for approval. So thank you.
Thank you, Lauren. Elena, could you scroll back up to what Lauren was just talking about for Rule 6? It's up a little bit more. Yep. So to be clear, I know that what is after the parentheses is different, but I think the underlying piece, I believe, is the same. So as stakeholders, feel free to correct me here, especially Emily and Gina. I know you're experts in these 2 rules, but knowing that Rule 6 is repealed as of the 15th, Rule 17.00.30, I believe, is the reflection of Rule 6.00.30, which under C5, 17.00.30 is also suspended and being taken into consideration. So I'm not sure if anything additional needs to be done. Again, even though the parentheses is different afterwards. If anybody wants to comment on that, you're more than welcome, but I believe they are one and the same, and 5 should take care of it. So Angie, I see your hand is raised. I'm going to unmute you now. Angie, go ahead.
Hi, Dimitri. Thank you. So I don't have a comment about what you were just referring to, but just to back up a little bit to the conversation around CLIA, wave testing, et cetera. I just wanted to make a comment on the record that the retail chain pharmacies wouldn't be interested in seeing a regulation specifying CLIA waive for COVID testing because many of the tests are still processed at a lab and aren't CLIA waived yet. We think the pharmacist should have the authority to order and administer any form of COVID test and should not be restricted to the CLIA waive test.
So Angie,
we've had some issues, I think, in other states with that, so.
Gotcha. So I just want to be clear, Elena, if you want to go down to D1. Yeah, so Angie, this should be fine, right? In regards to the comment that you mentioned?
Yeah, I think so. I just wanted to be sure. I think somebody was, I wasn't sure where some of the comments were going, and I'm sorry, I don't know who the speaker was, but
no worries.
Wanted to be sure that, we were on record saying that this part, that D1 part, is something that we would like to see kept as is.
Okay, thank you. So Gina raised a question. Gina, do you want to raise your hand just to signal me that I should read this to the group? Okay, so Gina mentioned in our conversations with CDPHE, they've been very clear on the need for adequate ventilation and airflow when performing nasal swab tests. Thus, the need to perform tests outside of the licensed pharmacy would be necessary. I think that has been clarified, but adding the comment. Thank you, Gina, appreciate it. All right. And Gina, you raise your hand. I'm going to go ahead and unmute you. Gina, go ahead.
Yeah, just answering your question, Dimitri, about the now in
6 and
effect.
17?
Yeah, 6 and 17, you're correct.
Yeah.
Thank you.
Okay, good. I appreciate that. Thank you. All right. So Gina, I'm going to mute you. And okay, so Elena, if you want to go ahead and continue scrolling down towards the end, I think that may have taken the majority of the stakeholder feedback, but I'll continue to monitor, see if there's any other input. And again, while Elena does this, Darcy, do you want to just take a moment and remind individuals that they'll have an opportunity to submit other well, I guess no, that cutoff has passed. We're right in the cusp of it, right?
Yeah, and we'll go through the process at the end of what the next steps are. So this is not the last opportunity to comment, assuming the board wants to move forward with permanent rulemaking.
Yeah, jumping ahead. My apologies. Looks like there's a question from John Sabaka. I'm sorry if I didn't get the last name right. So John says, on the behalf of Children's Hospital Colorado, in support of D2, changing 21.20.23 to a 12-hour BUD. So 21.20.23 changing to a 12-hour BUD, which it is as there. Good. BUD, let's see, for containers opened in an ISO 5 environment. And then also from Rob Guess, on behalf of Albertsons Companies, I wanted to express our support of the comments made so far related to COVID testing and remote processing. Thank you, Rob. And it looks like there's another comment from Rachel Gray with Alto Pharmacy. Would like to support the comments already made with regard to minimum hours and remote processing. Okay, looks like there's no more comments and hands raised. Darcy, I'm going to pass it over to you.
All right. Thank you, Dimitri, and everyone. So again, thank you for participating in the stakeholder meeting today. The stakeholder comments and program recommendations will be presented to the board before the permanent rulemaking hearing, which is tentatively scheduled for July 16th, 2020. Because of the quick turnaround with the emergency rules, the stakeholder meeting and the board meeting on Thursday, these comments will actually be given to the board before the meeting on Thursday for discussion by the board at that meeting, and the board will determine then if the board wants to move forward with permanent rulemaking. At the formal hearing, if the board does decide to move forward with permanent rulemaking, then at the formal hearing in July, stakeholders will have another opportunity to testify and provide additional input as needed. If you want to provide written comments, please send them to the general mailbox at dora_dpo_rulemaking@state.co.us. And we will continue to accept those written comments. It is, like I said, a tight turnaround from today and the meeting on Thursday, but we'll do our best to get the information before the board so it can discuss everything at this upcoming meeting. And then we'll keep you updated as well about whether there'll be another stakeholder meeting determining once the board determines whether the board wants to move forward with permanent rulemaking. So that concludes the stakeholder meeting for today. We thank you again for participating, and we are going to go ahead and end the webinar now.